Welcome back to another episode of Sports Medicine on Tap. My name is Brandon O'Line. I'm sitting at Neck of the Woods Brewing Company with my good friend Dr. Frey, a table full of amazing sports medicine professionals. Dr. Frey, how you doing?
Spectacular.
We have a routine regular at this rate, Dr. Brad Bernardini.
Yeah.
Hello.
Yeah. One of the creators. The creator, actually.
One of the founding fathers of the podcast.
Thank you.
And then we have across the table from him, Kevin Biles. So
tell us all about Kevin here, Brad.
Yeah.
Kevin and I, have been working together for almost 20 years. 19
At least 40.
years.
At least 40.
So Kevin is the current athletic trainer at Delsea High School, assistant athletic director. He's got a really long CV, and I was kind of unprepared to speak about him.
Yeah.
But, really very accomplished, former president of Athletic Trainer Society of New Jersey, very involved in leadership. Rowan, assistant professor, or what do we call you?
We're
adjunct professors.
Preceptors.
That's
what we're
preceptors, yes.
I like it.
Sound like a
Preceptor,
transformer.
right?
But very involved in education of our young athletic training students that are coming out, and I think just really, as far as I'm concerned, just best of the best when it comes
Good
to
as they come, man.
Yeah, as good as they come.
I appreciate that.
Yeah, great guy. Great educator. Very high standards. I'm lucky enough to work with him on the sidelines at Delsea High School, and he basically makes my job very, very easy, and it's just a joy working with him. So, yeah, I probably could have done you more justice if I had
perfect.
your CV in front of me, but
If you really knew him,
if I really-
that
if I
relationship.
Yeah, if you really got to know him a little bit.
I
That's
think
it.
of him as more of a friend than a highly accomplished educator
That's
/ athletic trainer / assistant athletic director.
It's one of those things where you look back on it, and I can't believe it's close to 20 years we've
Yeah,
been doing
it's
this
kinda
together
crazy.
now, and that totally blew my mind. It was, you sit down, you try to prepare when you're going to speak at something like this. I'm like, holy cow,
Yeah.
it's really been that long.
Yeah, you were really scraping the bottom of the
That's
barrel.
it.
So
That's
Kevin
it.
said, we can't
We're
find
all-
anybody else. Are you
That's it.
interested in working with us?
Yeah.
That's it.
Yeah. So quick story about Kevin. For anyone who's listening and doesn't know about Paulsboro wrestling, it's worth checking out. It's like the history there, the level of quality in the it's actually an astounding story. At the middle school level, Kevin covers what would equate to kind of like the middle school sort of South Jersey like playoffs region, the better kids get invited and whatnot. And my daughter wrestled when she was in sixth grade, I think it was the year pre-COVID and whatnot. And there I am, sixth grade, seventh grade, I forget what year. There I am, and we're at the tournament, and I go out, and of course I'm on call. I get a phone call. I go out into the hallway, and next thing I know, all I hear is like, "Your daughter wrestled? Like she was up, and she's hurt." And I'm like, "You got to be kidding me!" And sure enough, Kevin's working it, which, as he does pretty much every year. And there she is. Yeah, she fractured her clavicle, and Kevin had taken care of her and whatnot. And of course, I was out in the hallway answering a freaking phone call. But nonetheless,
Typical doctor dad.
That's it.
I know.
Yeah, been there.
What else would you do on a Saturday,
Been
right?
there.
Or
That's right. That's
Sunday,
right.
whatever it is. Yeah.
Whatever day it is. Yeah, for sure. Yeah, and then also like the state championship wrestling, hanging out, watching that. Brought my son to that one, and that was a good time, man.
That was back. That was the team championships.
Team championships,
too, in the smaller
yeah.
gym and all. It was
For
great
sure.
vibes. Great
Yeah,
vibes.
yeah.
Great day.
Good stuff.
Yeah, so that brought us here today, and we took a little hiatus. We took a couple weeks off from producing a show. We recorded 2 shows the last time we actually sat down and talked, and now we're in the middle of March, which is a lot of cool stuff happening. First and foremost, it is Athletic Training Month, and then secondly, March Madness and college basketball is about to kick off and go crazy. So we're kind of combining those two. We're bringing some of the best in the athletic training world, and we're going to just chop it up and talk a little bit of sports and basketball.
I think Doctor Day is coming up next week or in a couple of weeks or something.
Yeah, good luck, buddy.
That's it.
There's some pretty good ones.
I got
pretty
nothing
good,
for that,
Pretty,
sorry.
pretty good injuries.
Yeah, so
to talk about out there.
Yeah, we got a couple things to discuss. I just kind of like I usually do, found some information online and just some marquee injuries to kind of keep an eye out for. We can start with the Kansas Jayhawks. 2 of their starters, a guard named Kevin McCullough Jr. has a bone bruise in his knee, and their center, Hunter Dickinson, dislocated his shoulder. They both played in their last game on the 9th, and they missed a subsequent game on the 13th, and now they play in 3 days from now, which would be the day after this show's released. So we can start there and kind of chop it up that way.
Yeah.
Who should we start with?
Let's talk about the shoulder dislocation. I think that's kind of an interesting injury in a basketball player.
Yeah.
We see this a lot in contact or combat sports, and let's use football as an example. A lot of times we'll see this in football. So basically what happens typically in a dislocation is you tear the structure in your shoulder called a labrum, which helps to provide stability to the shoulder. It's the attachment point for some of the ligaments that keep things tight. So there's a fairly high re-injury or redislocation rate in young people. A lot of these early studies were done in the military at West Point. And so we typically think of that as a surgical problem, but it's not an emergent surgical problem. So very often we can allow, a football player to get through the season. We typically use this thing called a Sully sling to kind of prevent them from getting into these at-risk positions, which are generally kind of arms kind of up and to the side and externally rotated, kind of like the freeze position, so to speak. It's really hard to do that in basketball, which is kind of an interesting thing, right? That's a position they're in all the time, rebounding, even just shooting. So you'd think it might be a more complicated injury in a football player, and to be honest, it's probably potentially more complicated in a basketball player.
And in this case, he's a center, so
right.
like his
post player.
So he's up in that position all the time, which is really concerning.
So, and the actual injury happened in the game on the 9th, right?
Correct.
March 9th, right? Okay, yeah. I don't know. I'm kind of curious, Kevin. What are your thoughts? How often do you see it? We have the good fortune of a lot of the taking care of your team. Brad's generally the guy, the point person there, and so a lot of your athletes kind of filter through us. But truth is, people can go anywhere they want to go, and sometimes they do.
Absolutely.
They go elsewhere and they see other docs and whatnot. What do you see? What kind of variation do you see across the board there sometimes in terms of like? So let's assume, in a couple of assumptions here, we don't have access to any of the players we're talking about. We don't, we're not releasing their information. We just have public information. We're just talking about those like types of injuries. Yeah. But how often do you see? Let's assume that this is a first-time dislocation for this particular guy, and with or without labral tear, hopefully without labral tear or whatnot. Where do you see you normally going or frequently going?
The first thing with something like this, it's interesting. If you're looking at a post player that size, and you see a picture of this kid, he's a big piece of meatloaf. Yeah. There's a lot of man there. So the force to make something like that pop out is pretty significant.
Right.
Dealing with more of a pediatric population, you're dealing with a lot less muscle mass. Yeah. And unfortunately, once that pops out, pops back in, everything's fine. You still don't have that large muscle mass really holding anything in place there. So that tendency for it to happen again, and maybe like a 10th grade female, things can get a little bit more complicated with that as well too, where their level of game may not be the same either, and that's where things can get a little complicated. Like Brad said, in situations like this, we're putting a person in a Sully, if it's a senior athlete, and I really want to finish the season. You send them to do orthopedic, you get the test done. You want to make sure you get to the right orthopedic as well too. You want to make sure you're getting that sports medicine specialist that can understand the psyche of the athlete as opposed to a lady or a gentleman that's dealing with a different sort of population. Right. And so that's a big part of it as well too, where it's not unheard of. You send someone off with a shoulder dislocation, okay, you're done, 4 to 6 months.
Yeah.
That's not viable in this situation. I have a hard time taking that away from a kid. If we can put them in a position to get on and be safe. As Brad said, you put them in a Sully, you're trying to do your best to make sure that joint is more stabilized so when they get out and they can compete. A little bit of feedback too, Dr. Frey, about the fact we want to be cautious about putting your body in those positions where you're going to get whacked again.
Right.
Yeah. Now that's like holding the ocean back with a broom sometimes. When they start playing, they're going to do whatever the heck they want to do.
Yeah, things happen, right? Yeah.
But the braces and go with Dominique Oscabish and go with God, and let's see what we can do here.
Yeah.
And that's
And I think a lot of this probably falls back on you, Kevin, because what I would say to this athlete is, look, there's some good science that says that if you're not recurrently dislocating, you can safely make it through the season. The outcomes are no worse if we fix you after the season versus in the middle of the season. But the rehab, the strengthening, the education, a lot of times falls back on the athletic trainer, which I think is really important. Right. So this is a good example of knowing your athletic trainer and the relationship that we have. I know that you're well capable to handle that.
Yeah.
And oftentimes a sports medicine doc who maybe doesn't have that relationship with the trainer would send that athlete to a physical therapist.
Right.
And maybe you start to lose some of the continuity of care because there's not a point of contact. You and I call each other, text each other, send each other funny pictures.
That's it.
Real
intellectual stuff sometimes.
Yeah. But it's nice to have that kind of relationship where you can say, hey, this kid's out. We know these kids. You know these kids better than I do, but I may get to know some of them a little bit. But I think the strengthening and the education really falls in your lap, and I think that's really the importance of a good athletic trainer in many cases.
Well, you think about the support staff behind, at the
he's going to have the
Rock
best
Chalk Jayhawk, whatever he needs, he's going to get. He's in a great place to be able to get back safely on that court. Yeah. Absolutely.
Yeah.
Brad, what do you do when the athlete first comes in the office, right? Like it tells you what happened, dislocated, someone popped in on the sideline or went to the emergency room or whatever it was. Comes walking in with a sling. The injury happened 3 days ago.
Yeah.
What's your approach there?
Yeah. So physical exam is always critical. I think it's really important to listen to the athlete. I found that the older I get, the more I get from the history and just talking to an athlete. So I sit down and take time to listen to them and what they describe. Very often people say my shoulder popped out.
Yeah.
But a real dislocation typically is a very dramatic event, and the shoulder is deformed. It's obviously, something is pretty significant. Many times has to be put back in place by a provider. Right. So when somebody says, hey, I popped my shoulder out, but, and then it clicked again and I was okay, that may not really have been a dislocation, which it may be something we call subluxation, which is a kind of a shift of the shoulder, but not all the way out. Yeah. And so I think it's important to start with that because they have different algorithms. But a full dislocation, carries with it a fairly high risk of, these labrum tears, which you won't see on an X-ray.
Right.
Sometimes it can chip off some bone, and that's something you will see on an X-ray. Right. So we always get an X-ray. The other thing I think it's really important to look at is there's a nerve that it's called the axillary nerve that is often stretched at the same time as a dislocation, because when this shoulder comes out, everything's moving in a way that the body's not normally designed to move in. And so nerves are tethered at certain places and they can stretch, and it can cause some dysfunction with your deltoid muscle, and it can cause some numbness in the outside part of your shoulder. And I think it's important to identify because that can affect treatment and outcome.
Sure.
Those usually come back, but I think it's important to look at for people listening. I almost always get an MRI pretty, acutely. It's not an emergency, but we want to get that done. And then, again, these studies suggest that we can allow players to return to play. My criteria are full motion, full strength. I'm okay if you're a little sore, but you have to have protective strength. So that's where that muscle kind of rehab part comes in.
What do you guys think about slings after the fact as well, too? I mean, it's the argument amongst a lot of athletic trainers. We're going to put them in a sling right away to keep them safe. Mm-hmm. Yeah. But my 2 cents on that: the sooner we get them out, the sooner we get them moving, the better off.
Right. Yeah.
I mean, you can overprotect there, and that's one of those things where a lot of our people we battle back and forth.
And I think so. I feel the same way, Kevin. Go figure.
That's it.
Yeah, right.
But I think one of the things that's really important to think about there too is the psychology part of it, a sports-related injury, right? And so I'm not a huge brace user. I'm not a huge sling user if we can get away from it. And because I think that starts to create this something's wrong with me kind of mentality, and it starts to allow you to decondition a little bit. And so the sooner you can start to allow an athlete to prove to themselves that they're, that they've got some physical capability and that it's okay to start moving, and hey, this isn't as bad as I thought it would be, the better for them getting back to sport.
I think I've evolved over time on that particular point, where I would go a little longer, 2 weeks, 3 weeks in the sling, and I think the data's showing leaning more towards not more than a week, maybe 10 days kind of a thing. Yep. Get moving soon. Right off the bat, really early on, I will typically use a sling. There's a fair amount of discomfort, and I feel like it's still pretty unstable right there at the very beginning. And you just
that first week, I totally agree. Yeah. I'm absolutely fine. And then once that acute phase improves, and their muscles start to wake up again.
Right, exactly. Yep. And then weaning out of it pretty quickly.
Yep.
So this gets controversial, right? Mm-hmm. Do the MRI. Let's say there is not a labral tear. You feel a little bit better about things. How quickly are people typically getting back?
Without a labral tear?
Yeah, first without, and then with.
I think it's pretty variable, to be honest. Mm-hmm. I mean, a lot of times, look, just anecdotally, when I get hurt, I jump in an MRI, and if it looks pretty good, all of a sudden I feel better. Mm-hmm. So I think an MRI without a structural injury can all of a sudden make the athlete and their family and their coach and their trainer feel
Again, it kind of ties back into the psychological part.
Absolutely. Big part of it, right? So I think those athletes can get back pretty quickly.
Yeah.
With the tear, it's a different story.
What do you think? Do you think he's playing in the first round here, Brandon?
I'm gonna say probably. I mean, it's been about give or take almost 2 weeks. It's had some time for the inflammation to calm down a little bit, and I'm sure he's been using all the modalities and different things that they have at Kansas, and trying to get back as best he can. So, and it's when we always talk about like the things in sports medicine, like it's the tournament, it's the big time.
You're
it's
not
like,
missing
it's,
that.
It's
Yeah.
the, it's
You're
the
not missing that.
playoffs.
Fourth seed, still a good team.
Yeah,
absolutely.
postseason, and you're trying to make a name for your team and everything. So
Name for yourself, too.
Yeah, and that too, right? And like, I'm not sure his what class he's in, but with these young guys, these use the tournaments as like a highlight reel for the next level, and NBA and other things like that. So you make a big name in yourself in the tournament, you have a better chance, get drafted and so on and so forth. So I think he plays.
Yeah.
Kev, you think if he's a point guard, you feel a little more safe about getting him back in there as opposed to being a center?
Absolutely, but
Is that because you don't care about small people?
that's exactly what it is. Don't take it personal, okay? That snuck out on me a little bit there. But, is it a different game? Yeah, but, going back to that same point, when you're at that level, when it's, when you're in those blood rounds of that tournament, it's going to be end all be all, and you're going to hop in with both feet. So is he in a better position as opposed to, say, a 4 or 5? If he's a 1 or a 2, I agree. Yeah. As long as you can get your arm up over your head and score, that's fine.
Right.
But in the case of this guy, I think he definitely has a different battle to fight right now. And I think his teammate, that's an interesting case.
Right. I like where you're going.
I mean, this guy's he's a potential All-American, potential first-round draft,
Right.
this kid.
Yeah.
And Coach Self is really holding his cards close to his chest as far as what he's known. The Dickinson's kid said, he's fine.
Yeah.
He's going to get out there. This kid, he's a little bit,
Right.
He's hedging a little bit his bet there. So
Yeah.
that was a re-injury, wasn't it? The knee, the bone bruise.
I'm not sure.
The McCullough kid. I think that
Nice,
was a
Kevin.
re-injury.
Nice.
Do we know anything more about that particular injury other than bone bruise?
Again, from what I was reading, again, it's just me waking up in the morning, you open up USA Today and see what, make sure I get my bracket correct.
That's my style.
Which is, I might as well, as we said, just light a $20 bill on fire. But it's they're a little bit more concerned about that one as opposed to the big man in the paint. So
Right.
Yeah.
What are your thoughts about that, Brand?
Well, we've done
The bone bruising.
the Bone Bruise
yeah.
podcast before, and that's on the surface it seems like a pretty benign thing. Oh, thank God, it's just a bruise.
Right.
Right.
But we've talked about the
Suckers hurt.
long-term implications of a bone bruise can have cartilage injury, long-term development of what we call chondrolysis, which eventually ends up being like early development of cartilage damage, arthritis kind of pattern. Those are tricky.
Yeah.
Yeah, I mean, they settle down for sure, and I think people usually can get back,
Right.
but maybe the longer term or midterm implications of those are a little bit more complex, and it really depends on the severity of the bone bruise and if there's any structural damage associated with it. Many times a bone bruise will be the easy thing to report, and then there's other, you got a little stretch of a
Things
ligament.
happening.
So,
Yeah.
So it's tricky. The devil's in the details on those.
Yeah. And I think basketball is one of those ones where you just don't want knee problems with, and like the bone bruise is like so common, and
Yeah.
like, we've seen it a lot in the like we said, we've covered it for Joel Embiid, and many of times that he's been bruised.
Mr. Glass.
Yeah.
So,
For the 14th show.
Yeah.
Yeah, he's got a record. I think he's
probably-
been a topic more than
Yeah.
Brad's been on the show. So.
Yeah.
Um,
Well said.
But still, you're curious about it, and like we kind of said of the draft stock and other things like that, it's like you don't want this kid to go out there with a knee that's kind of jacked up already, and then he goes potentially injuring it again. That can mess up his draft stock, and that
Right.
can mess up how GMs and other people who you view him and kind of like rate him on the draft board. So
Yeah.
you want him to see him go out there because, it's a big implications, but you also want to make sure he's safe and he can go to the next level, because that's kind of what
And he's helping the team, not
Right.
hurting the team.
Correct.
And
a
it's
lot
funny.
of weight on his shoulders right now.
Yeah.
Yeah.
That's quite a decision to make,
Yeah. Yeah.
And I'm glad you're on the show, Brad, because and like I'm glad that you were answering that question, because we've been working towards, or we've been talking about working towards having similar protocols throughout our group, right? Like all the sports doc, all the sports managers, everyone kind of doing the same thing the same way every time. And we know that one of the places where you diverge from what I think most docs are, and with that, not without reason, is if someone tears their ACL, and we're not saying that he tore his ACL, but if someone tears their ACL, part of that injury is usually there's this this standard bone bruising pattern, a pivot shift bone bruising pattern, and you put them on crutches for that, whereas I think most other docs don't.
It's not for the bone bruise. It's really for the instability risk. So, what I do for ACL injuries is, if somebody's experiencing instability events, and surprisingly not everybody does.
Right.
But if they say, my knee feels unstable, I feel it shift, I feel it give.
Yeah.
I put them on crutches, and the reason for that is because if there's some literature out there that shows that you can have about a 30% rate of progression of damage to the knee with recurrent instability events. So if your knee
see it a lot. You see that meniscus tear that wasn't there on the MRI.
Yeah. So, the medial meniscus is the most likely thing to occur with a chronic ACL insufficiency. So if you have ongoing instability events from your ACL not having been fixed, or if you decided you didn't want to treat it, but your knee's shifting, the medial meniscus tries to take up the slack, so to speak, and it tries to compensate, and it's not built to do that, so that can tear. The other thing that we see is cartilage damage, and those things are potentially, in some cases, replaceable or unfixable.
Right.
And so, if we can avoid that, and if we're prepping to fix somebody, then for the time it takes to get them to the operating room, which we try to do fairly quickly, with we have them meet certain criteria before the procedure. To me, that's the lesser of two evils. Therapists will argue that they're going to decondition, their muscles are going to weaken, but that's stuff that we can get back.
Right.
But if you tear your meniscus or you damage cartilage, maybe we can try to fix it in the operating room. Maybe it's repairable, but still, you're never the same. And I'd much rather have an athlete with an isolated ACL tear to reconstruct versus a combination injury where there's complex cartilage damage. So, I'm a little bit more protective and.
I
think you guys have called me out on this. Like, there's an article that I know I read.
right.
Somewhere.
It exists. It exists.
In a dream. Somewhere out there. I think it was prepping for one of my board recertifications where they looked at this study and just one event. Yeah. One event can cause it. So how do you know when that event's going to happen? And the only way to really protect against it is to not put full weight bearing on it. And braces have been shown not to control rotational stability very well. So theoretically, a brace is not really fully protective. It helps, but it's not fully protective.
And my goal is not to call you out on it, because
I think it's good. That's a controversial thing to talk about.
Yeah.
I just think, what would I do for my kid?
Right.
Within reason. Like, and I try to, I'm not just being emotional about it.
Sure.
But, get on your crutches. I don't want you blowing your
protect that knee, man.
I don't need you. We don't need the doctor coming out of the operating room saying, "Hey, guess what I found?"
Right.
Found some extra stuff in there.
Yeah, extra stuff.
That wasn't there 2 weeks ago,
And that happens, right?
Yeah. Little gifts.
Little gifts.
And I think it's interesting, too, like what you said, like just use the crutches, other things. I tore my ACL, and those instability events suck.
Yeah.
That feeling of your knee just giving out on you and you can't do anything about it, like, it's terrible. And who knows what it did. I think.
And you can't prepare for that.
No.
Like, there's no, you're athletic, your whole life you've had your ACL. And all of a sudden you don't have it, and you're like, so it's not like, I think a lot of athletes say, no, I'm fine. I'm good.
Yeah.
I got this.
Yeah.
You're also a big proponent of the fact, too, that the MRI is a snapshot of what you're seeing in there, too.
Oh, yeah.
It's not a dynamic indicator of what's going on in there.
Right.
So while it may look like one thing predicated upon the MRI, when you guys get in there, you're seeing a totally different, environment.
Yeah.
And it, like you said, why wouldn't you protect it in a situation like that?
Yeah.
And again, the whole thing is trying to find that right balance to it. But
I don't want to unnecessarily decondition somebody or limit them, but that's one of those things that, look, if we've decided, hey, we're going to do surgery and we just need to rehab, you get your motion back, get the swelling down,
that's a big one,
then that's what I do. If we've decided, this is somebody who says, well, I'm going to try to not have this fixed and we're going to try to cope and I'm not a high demand person, there's a handful of them.
Right.
Do you know Heinz Ward?
Yeah.
Had an ACL deficiency since high school?
He did,
Yeah.
John Elway?
Swear to God.
Yeah, one of the copers.
Unreal.
I tell people that all the time in the office, and they look at me. We're getting to the point now when I say Heinz Ward, they're like, who are you talking about?
Yeah,
but most people still recognize Elway.
Yeah.
But I tell people that all the time.
So not everybody, it's a small percentage, but not everybody has to have it fixed. If we decided we're going the other way, then no, we're not going to put them on crutches because they got to prove it.
Get going.
Yeah.
But then there's also the standpoint, too, of, like, I say it a lot with my athletes, like, I'm not just protecting you, I'm protecting you from other people. Like, when you walk by somebody in a sling, we were talking about the sling, you're going to stay away from them. When you see someone walking with you with crutches, the chance of you bumping into somebody is
it's
a lot
bill-
less,
it's
right?
It's a
I
billboard.
work in a high school. I mean, it's a battleground in itself on a good day. Right? So I won that billboard, and we
Right.
spoke about that. Do I really have to wear it? I'm like, yeah, because that tells everyone, get the hell away from
Yeah,
me. And
exactly.
it creates a safer environment, not
No.
only for you, but
Yeah, same. Yeah, definitely.
Yep.
So that was a good one.
Right.
So now we'll change gears a little bit here, and we'll talk about the Marquette Golden Eagles with their guard Tyler Kolek, who's been dealing with an oblique strain since the end of February 28th. He missed the final 3 games of the season, and the reports are that he's hopeful to play in the NCAA tournament.
Basketball players.
don't get me started, right? What a miserable.
You guys know
that
how I
is.
feel about basketball players.
I know. They're all taller than
It's
you.
all of exactly. We're both gone.
There's a lob over the plate, Dr.
Right.
Fred,
I know.
Thanks,
That's one of those weird injuries, right?
Right.
And I wish we had a little more information about it, right? Like, is this a truly an oblique injury, which I think we overmiss a little bit, or we kind of miss a little bit because it's one of those ones where it sees you don't see it necessarily.
Right.
And there's nothing to. I mean, I
Not
shouldn't say
too
there's
much-
nothing to do, but we're not. Yeah, we tend to think about the things that are a bit more structural,
Right.
and a little
Right.
bit more surgical, and a little bit more.
But could this be down, lower down? Could this be athletic pubalgia or some version of that? So with sports hernia, depending on, which is the same thing, right? Like, with just different terms,
Right.
or something along those lines. Is this truly an oblique injury? I don't know, man. I got to say, you give it a little bit of time, let them start to bounce back, and then, like, you have something like this, you go play.
Yeah, go play.
Yeah.
Yeah.
This may stick with you for the rest of the season, but yeah, go play.
Yeah. What do you think, Kev?
Kevin?
Do you help a kid play in that situation?
What's that?
Do you help a kid play in that situation, or
I
I mean,
wouldn't.
again, you wouldn't do
This-
that. And,
I
I mean,
don't.
this
And
is
the-
a last case
yeah.
situation for a
And-
kid to play in the NCAA
Nah.
tournament.
Yeah.
I think it's a great indicator of pain when you know you can and can't go. That always makes
Yeah,
me
I do
nervous
too.
when a,
Very
And,
careful.
it's interesting
That's it.
when we took over coverage for the Philadelphia
That's
Soul.
right. I knew this. You're going to
You
go with
knew I
this.
was going?
Yeah.
There was a little bit of a different philosophy with the previous,
Okay.
medical team, and they would do a little bit more like aggressive pain management to allow people to play, which I think is it's fine. It's a little bit of an older school, I think, mentality.
Yeah.
And when we came on board, they'd come in and say, "Hey, doc, I need that shot, or I need that, med." And we're like, "Well, we're not going to do that," And it was a little bit of a shock to them. I think they.
Even if it's in their best interest at times, right?
Yeah, they're a little bit uncertain, but I think at the end, I think they understood that we were trying to do it to just, my opinion is, look, the less we have to do to you, the better, and whether that be surgery or injections or oral medication or whatever. So, the body wants to heal. Sometimes you have to give it the opportunity to do that, and it's we evolved that pain for a reason. If something's so badly damaged that you can't go,
Right.
then maybe you shouldn't go.
So to answer your question, I've never done that. If there's a time that I was going to think about it, this might be one of those times, but I would be very, very reluctant to. And I don't know. I don't know if it puts us in the minority.
I would say that I think the environment would change if this conversation was just to start at a round of 64 versus the championship game.
Absolutely.
Right.
Right.
That's where I think the conversation changes.
Marquette's
a little bit.
good this year, man. They
Yeah,
could be
are.
one of those teams.
Shaka Smart's got them playing.
Yeah,
They're for real.
I know.
And dealing with a pediatric population too. If I have a 16-year-old kid tell me I'm feeling moderate pain right now, ethically, I have a real issue putting that individual in a position where his pain's going to get worse.
Right.
Okay, where her pain's going to get worse.
Right.
So I mean, it's one thing if you're a professional athlete. Again, I'm not condoning any behavior whatsoever.
Right.
If this is your life, I can understand that to a
Sure.
degree.
Yeah.
But when you're dealing with a child, and that's what I'm dealing with.
Right.
You're looking at an athlete that's 18 and younger, even at the quote-unquote adult at 18.
Yeah.
I have a real issue with a kid coming and saying, I got a pain 7 out of 10 right now, but I got a first round of a consolation tournament. I really need to play. Do you really need to play in it?
Yeah.
Right.
What are we doing here? So
Right.
I
And,
think it really depends on that population.
And oftentimes, you could probably speak to this much better than I can. You're treating the parents.
Oh, yeah.
Oh, yeah.
Yeah,
Yeah,
because the
absolutely.
parents think that kid's going to get his scholarship, and they think they have to be in this game, and there's a lot of psychology there in family dynamics that I think are important to be able to kind of create some boundaries on.
How that runs the spectrum, too.
Yeah,
I mean, it's-
5% of athletes go on to the next level, right?
Right.
So, is this a 5%er? I mean, if they are, maybe. Yeah, maybe you do something to help them kind of get that scholarship that could be worth, a lot of money to the family that may not otherwise be able to afford it. And, but those are very serious discussions, and very often they're obviously in athletes that are high level, and you know who they are coming in. But the rest of us, hey, let's get better and then we'll move on.
Who was it? Was it the Chargers? One of the quarterbacks? Was it playoffs? Where I don't remember if it was a rib issue or if it was an oblique issue, and they tried to inject him.
Tyrod Taylor.
Tyrod Taylor. That's who it was, right?
That was the beginning.
Punctured his lung.
They punctured his lung, and that's when Justin Herbert got his start.
Yeah.
And the rest is history. And Tyrod Taylor bounced around.
Well, there's a perfect example of do no harm kind of stuff.
Right.
Like, I'm not going to, And just for the record, I played my senior year of football at Bucknell with a broken rib.
Oh, yeah?
You're so tough.
And I had some pretty good stats.
Did you play hockey as well?
No.
Yeah.
I mean, what type of injection would that be into?
And I never had an injection.
That would be brutal. Taking a shot down there, how would you even approach that?
I think it would be one of those, and again, I've never done this particular injection, right? But I think you find a point of maximal tenderness where it hurts the most and just kind of.
I can tell you what I would do. I would send him to one of our non-operative ultrasound-guided injection specialists, like Dr. Nate Holmes.
Yeah.
And he's going to put an ultrasound on there. He's going to find the area of maximal inflammation and edema, and he's going to watch that needle not go into their lungs.
Right.
And he's going to put it where it needs to be. And if there's going to be an effective injection, that's probably one of the more...
the way to do it.
Yeah.
You can see some disorganization, sometimes a little layer of edema, something or other.
Something, he'll see something.
Here it is. Boom.
Yeah.
That's interesting, So we can bounce to the similar injury for two different individuals from two different teams from Purdue and Alabama. They both have guards dealing with a calf injury.
My nemesis.
Braden Smith from the Purdue Boilermakers injured his calf on the 15th and played again on the 16th. And then I thought it was interesting when they were talking about him on the article I was reading. A teammate of his was like, "Oh yeah, he's tough as nails. He played half of the season in high school with a broken foot. He'll be fine with his little calf injury."
He alternates between hockey and basketball.
Yeah, right.
Sorry.
He's on attack mode.
Toughest guys around.
But I think that the calf injury in basketball is, it's scary because I think the most common or most recent injury with that is like the Kevin Durant situation where he had the calf injury and then he goes out there to playoffs. The next thing you know, his Achilles pops, and that's a whole different ball game, and that's
bad news.
Way worse.
So what do we all think about calf injuries?
The worst ever? No, just frustrating, right? Very frustrating injury.
Just tricky,
very tricky.
For that exact reason, right? You don't know if you're on the Kevin Durant side of the spectrum or if you're on the I can play through this side of the spectrum. I think that oftentimes a younger athlete, high school athlete, college athlete, is more on the you can play through it, even though it bothers you. Maybe you're not 100%, but you can do it. I think once you start getting more to the Kevin Durant or the Brad Bernardini or the Steve Frey side of things, you start to learn like I better stop running when I feel the creeping up, right? Like I'm not going to run through and it's going to go away. Yeah. It's going to tweak, it's going to pop, and then I'm not going to run for the next month. And it's very, very frustrating.
The other thing I think is really important about with calf injuries is, very often it's easy to say you have a calf strain. I think it's harder to say why you have it, and I think very often there's a remote dysfunction somewhere, whether it be hip extension or some kind of issue that is now causing your calf to have to do overtime or compensate for something else, and it's not meant to do that. And really your calf is just a kind of a shock absorber. It's just meant to kind of absorb and recoil your body weight. It's not really a driver of movement, and your glutes and your muscles that are farther up the chain. And so I often find that they have a dysfunction farther up, in their hip or their glute or their hammy.
Now, this kid ended up playing? I mean, they lost to Wisconsin, I think, in the Big Ten semifinals.
Yeah,
and
he played.
His stats weren't great, and it was quite evident he was on pretty short leash.
Right.
But he got out there and played. How did he do that? Was that it wasn't traumatic, or was it?
No, I don't. I just think it just kind of happened, and then they kept kind of like we said, it doesn't really have a specific mechanism each time it happens. It just kind of happens. And then they kind of, deal with it or whatever. But he was able to continue playing. Then he played the following day with it too. So it's just probably a little bit of soreness and tolerance. And they avoided anything serious with that one. You know what I mean?
It's amazing how many athletes at college and pro levels have hamstring strains, calf strains. I feel like they're kind of preventable if you do a really good eccentric strengthening prevention program, mobility.
Yeah.
I just don't know if the focus is there for those prevention, because it's not sexy to do prevention strengthening or mobility. It's like,
But maxing out your squat and putting it on Instagram
yeah,
for TikTok, that's
when
sexy.
people yell
attractive.
behind you, right?
Yeah, and they get all crazy, and you have
Bend your
bad
knees
form.
at 45 degrees, right?
Yeah.
Yeah, that looks great.
So I don't know. It's a shame because there's some good science behind prevention programs.
Right.
Yeah.
And I think there's a reduction. I wouldn't, not completely preventable, right? Like they're going to happen.
Yeah, sure,
But
There's
certainly
some-
reduction in some rate. Yeah. And that's part of what, the MO for the Energy Lab has been, is trying to get it on that side of things
Yeah.
before you're treating the injury.
Yeah, education and prevention.
Yeah, and I think, like you said, like the primary moves, the glutes and other things are, chronically that we find in our everyday practice. You have weak glutes, or how many times you've heard that? It's just like those systems aren't trained properly enough. Because
I've never heard that person.
Never. Someone at your level probably wouldn't, right?
But you don't get that kind of training and other things to focus on those things because everyone just wants to do the cool, bigger,
Sexy
faster,
stuff.
stronger
Yeah.
stuff.
Exactly.
They
We've
wanna-
actually had teams that have come into the Energy Lab say, "Yeah, thanks, but this isn't. They're not. They don't feel like they're getting worked out."
Right.
And it's a
Right.
shame.
They're
You try to educate,
sort of
but
missing the point
Yeah,
there.
they're missing the point. At the
Yeah.
end of the day, it's these things are not a lot of the things that we do to kind of help prevent injuries and maybe optimize the way people move and they're not exciting movements.
No.
They're not. They don't build beach muscles.
Right.
They're very functional, but they're it's a shame.
just-
but that's
There's a difference between
You have to buy into
working
that
out
concept.
to get strong and working out versus working out to prevent injury.
Absolutely.
and to be functional, right?
Yeah.
Like I think
That's what
functional
it- yeah.
training is just overlooked in a lot of ways. It's just
For sure.
like let's just do this, old school powerlifting. Let's try to everyone get strong like Arnold Schwarzenegger. and,
Yeah.
like, let's go crazy. But it's like
he did look good though.
right, massive. But
We try to sell that to younger kids as well, too. That whole day, it's not safe to be in a weight room. No, not necessarily. When you're looking at employing a strength training program for the first time, you're trying to express that whole concept of neural recruitment. Listen, this isn't necessarily muscle getting bigger.
Right.
Right.
This is your brain communicating with those muscles better to effectively
Right.
utilize that motion.
It's hard to
and
sell.
And they're like, but I'm like, just hold on here. You're learning these motions. And particularly when you see these groups where these kids are playing on 3 different teams and you're burning that candle at both ends, and where you're investing in so many other areas. Why wouldn't you invest in this area too? And that's
Right.
what blows my mind.
Because
Or-
kids don't feel like they're getting in.
That's
they're
it.
not. I'm not getting worked.
that's
I'm not
what-
coming out sweating. I'm not coming out tired.
the amount of apophysitis we see right now in that 14 to 16-year-old
Yeah.
group because of that, it's absolutely incredible.
What is apophysitis?
I have no
Yeah.
idea. I just totally made that up.
Right.
So when that attachment, that muscle attaches to the bone, and it starts to tug more and more because Mary or Johnny may have grown 6 inches in 6 months, and the body's playing a little bit of catch up there.
Yeah.
But we won't have them playing on 3 different teams in 3 different areas. But they're not warming up. They're not effectively working through proper motions, and it leads to things.
And then when
like
they're home,
that.
they're sitting in front of their tech.
Exactly.
yeah,
Big swings of activity.
That's it.
right.
That's it. That candy ain't going to crush itself,
No.
right?
That's great. And then we'll go to kind of the bigger injury from the conference championships this weekend.
It's always nice. Like we've talked about doing the gory, grotesque, like show, just like
Yeah.
injury after injury after injury. After
Theismann.
Yeah, exactly. This
I
kind
just
of
dated
this,
myself.
This one works up into that category, don't
yeah.
you think?
Oh
It
yeah.
does
I
it.
mean, so I found out about this. Ironically, one of my good friends, my buddy named Shockey, he texted me. He goes, "Kevin Ware type injury just happened in the SEC game." And I said, "Whoa, that's a
Slow down.
Slow down there, buddy. I got to get my Twitter out. I got to change my.
it. No.
I had to go chase my 1.5-year-old with the remote, try to change the channel, the whole nine. And so I went, and Micah hand logged in their center. It was pretty early in the game too. He went up for a rebound, and he came down, and so did his everything. On
Yeah.
his, I think it was his
didn't
left
look
side.
good.
His ankle went out to the side, and his tibia went straight down to the floor. And it did not look good, and he was, in pain. And I saw some reports there was blood on the floor or whatnot.
Yeah.
So we're
It
dealing
looked
with
like it was open.
Yeah, it was
an open fracture.
It was definitely open.
And I mean, you really haven't seen any of this. Well, you see, it happens, but the big one, the Kevin Ware back in 2013 in an Elite 8 game he had, and everyone could see on national television his bone sticking out of his leg.
Yeah.
no.
So what's
this one-
what's an open fracture?
It's when you break a bone or there's and there's a break in the skin, kind of the layer between the outside environment and your bone, but it comes from the inside out. So typically that's breaking through all those layers there. And there are different gradations of it and whatnot, and it's by virtue of exposure then to the outside environment, it is a much worse injury than if it were just a fracture. Not that that's not a bad fracture to have in and of itself, but once it's open, it really just
becomes emergent.
It becomes emergent. Changes everything.
Yeah, because the bacteria that live in our skin, which is largely staph, can now get inside the body, and it can kind of colonize the fracture site and the bone. And if you don't get to that within, the standard has always been 6 hours. And interestingly, they were all like rat studies.
It actually backs off a little bit nowadays.
Right. Well, that's what I was going to say. The original studies were all rat studies. They were all like based on unfortunately, these poor rats would, be subject to open fractures and tested. And so we're not rats, so we definitely changed our philosophy with that, and whether it's inside out versus outside in, and whether it's grossly contaminated. If it happens in a slop pile at the farm, it's different than it happens on a clean basketball court.
See, this cracks me up. The way they look at something like this, and looking at it as an athletic trainer, the first thing that comes to my mind is, how am I stabilizing this kid? How am I keeping this kid? How am I keeping this kid, his vital signs stable? How am I protecting the wound? How am I evacuating this kid? Where is he going to? Luckily, this happened in Nashville. Luckily you got Vandy right there, one of the premier hospitals in the country. That no offense to Idaho or North Dakota, if you have a tournament out there or a place like that where you don't have that level one, that level one care right away, and that's, as an athletic trainer, that's how I look at it. It's, how are we protecting this individual? How are we keeping them stable? And how are we shipping them out so people like Dr. Frey and Dr. Bernardini can take over from there? Yeah. And one of the, reading an interesting article, the athletic trainer from the University of Florida, who's been around forever, he's a 30-year veteran through MLB. He was involved with the Tampa Bay Buccaneers a little bit. How blessed and how outstanding the care was there to take care of that and to make sure the kids doing fine.
Do you and Brandon want to talk about what emergency action plans are?
So
So when you're on the road, you're traveling, or you're elsewhere,
it's kind of funny. It's a secondary school level. What we do is we've created a website to where, say, if Brandon's the athletic trainer at Smith High School somewhere, and they may be from North Jersey and they're coming down to Southern New Jersey for a playoff game, they can access our website. And our website will tell them where the closest urgent cares are, where the closest level 1 trauma center is, who is the EMS unit that will be taking care of your kids. What's Dr. Bernardini's contact information? What is the medical staff that's going to be on hand to handle in the case of catastrophic injuries such as this? And I know at the collegiate level, you guys have a little bit more, at least at the Division III level, a little bit more in the way of facilities and resources.
Yeah. So, with that being said, usually very similar. If we're hosting any event, like we recently hosted last year, the NCAA tournament for Division III basketball, you send out your information, you send out your emergency action plans. Like, hey, this is what we're doing. These are our like you said, these are our doctors on site. This is how EMS is going to be activated. If we have to, this is the hospital they'll go to. If it's this, if it's higher up, they'll go here, and so on and so forth with directions. And I've even done it where I've even printed out Google Maps of the sky view of their, went on paint and just drew arrows of different where you had to go for different things and stuff like that. Yeah. And I think, with all this being said, I think it was, I want to say a year or two ago, there was a women's basketball tournament held in Las Vegas, I believe, inside a casino on the ballroom floor where an incident happened, and they had to wait over 20 plus minutes for a cervical type injury. And they're just, the athletic trainer was just stuck there holding stabilization, which is what else are you going to do in that situation?
Absolutely.
Terrifying.
When all those things are, in place. And for example, I just got back from our spring break trip with our baseball team in Florida on the tournament.
Nice stand, by the way. I like what you got
like
going
that?
on there.
Oh, yeah. I luckily didn't burn too bad. But the tournament sent out, just local information per county, what hospitals and other things like that. So then my step is, okay, now this is where we're staying. I'm going to look up urgent cares in our local area because they don't know where we're staying. Yeah. Local pharmacies and other things like that, because you never know what you're going to need. Yeah. Not my team, but another team that we were down there with, someone ended up getting tonsillitis, had to go to an urgent care. Where do you go? Obviously, it's easier now because you have just Google it real quick. But being prepared for those situations where, I've gone to a baseball game in the middle of nowhere. It was just down a dirt road and there's a baseball field. It's all right, well, there's no one here. I luckily have an AED traveling with me and other things like that. It's how the hell do you get out here? Or how do you do the other things? tricky.
I used to work at the U.S. ski team, and we used to go to the medical emergencies and skiing and snowboarding course.
Yeah.
And one of the docs got up and gave a talk about emergency action plans, and he covered an event in rural China. And part of his emergency action plan was this thing called Global Rescue, which was basically a group of like ex-special forces guys who would fly in a jet, pick you up, and bring you to like, out of third world medicine kind of environment.
But where were they flying in from? Like if you're in
Global
China.
Rescue?
Yeah.
They're all over the world.
How about that?
Yeah,
man?
it's the thing.
That's
You could pay for a membership
Right.
for Global Rescue, and if you're an adventure traveler, adventure racer, you're doing things all over the world and things. It's probably a reasonable thing to have access to, because when they would tell the stories about some of these places, I mean, they're primitive.
Right.
Primitive.
Oh yeah.
You're out there.
There's a level of rural that we just don't understand.
Yeah, that we have no
right.
idea. We take for granted what U.S. medicine's like, but so it's one thing to have logistics about I have to go 3 blocks around the corner to be at a level
Or get
one
through a
Trump
fence.
Or I have
Yeah.
right. So I think emergency action plans are really important, and this is the kind of event that is important to treat them, because we have a time clock that, again, those numbers have changed a little bit, but this is something we would consider, typically getting to pretty quickly.
Yeah.
And, we want to minimize contamination of the bone and the wound, and typically bring them to the operating room.
Yeah. The big thing is antibiotics, right?
Antibiotics.
So you got to get the antibiotics going as quickly as you can. I think that's where
Absolutely.
the 6 hours
Yep.
really, really is critical still.
And then you irrigate, wash it out. You basically dilute the bacteria that may have gotten on the inside, and then you fix it the way you're going to fix it, whether it be a rod or a plate.
And then that's the whole next controversy. Like, do you fix it right there and then, one setting? Do you come back to fix it? Do you fix the folks trying to fix it or hold it like that? And and Alex Smith, right? Like that's the whole thing.
Mm-hmm.
Like that was the disaster that you're trying to avoid. It was pretty amazing what that guy was able to do in terms of coming back with like multiple surgeries, infected, couldn't get rid of it, almost lost his leg, and like
that documentary was gross.
It's
The
crazy, right?
E60 on him was like, wow.
Yeah.
And you could do everything right, and it still sadly goes in that direction.
There's still an
right?
infection risk for sure.
Yeah.
And I mean, if you think about it, right? You open bone touching an athletic playing surface on any.
My God, yeah.
Less than ideal.
Better than pig slop.
That's it.
I keep saying
The
that.
barnyard,
Let me ask a question, Kevin.
Yes.
Is it normal for a college athlete to break their tibia coming down from a rebound?
Relatively routine too. Like didn't.
That's, and looking at that video too, when you saw it happen, there wasn't anything significantly traumatic. That the first thing that pops in my head with something like that, was there a pre-existing condition?
Right.
Was there an overuse injury there?
Like what?
Was there something where there was some sort of bony growth that weakened that specific area?
Yeah.
Like what?
You're throwing me under the bus here. Come on.
That's where you come in.
Maybe like a stress
That's
fracture?
it.
Yeah.
Well, that's what I'm saying. That overuse, and if you develop a stress fracture, or maybe it's something he was born with, no one ever saw it before.
Yeah.
Bone cyst, something
bone
or other.
cyst, tumor.
Absolutely.
Something
But
weird.
the first thing with a kid his size and the activity level, the first thing I'm thinking there is some sort of stress reaction that may not have been picked up.
I mean, a
And-
short guy wouldn't have broken his
no.
because
Shorter levers,
bones
right?
are
That's
much
it.
stronger.
You're closer to the ground,
Much
less
stronger.
pressure. But no, the stress fracture is the first thing you think about in
Right.
a situation like that, and the location where it went to. And it's like,
These are the dangers of allowing an athlete to continue to participate with a known stress fracture.
Right.
Right? Or, we always hear about, well, I'm okay, I can go. It's not really broken.
Right.
And so I think it's important to keep a little, video cache of, this is what
Absolutely.
happens to you if you continue to.
And we don't know that he had a
No,
stress
but
fracture.
we're
We don't
yeah,
know
this
that.
is the fun of the podcast.
well,
we're
that's
making some,
you're
we're
asking
making
an
some
armchair
assumptions.
quarterback this right
Yeah,
now.
it's
And
exactly
thanks for
what we're
throwing
doing.
up these
Well,
softballs.
this
This
is
is
what
my
we do.
first time doing it. I'm still trying to figure out this whole dynamic. But that's as an athletic trainer, I'm like,
Something's going.
yeah.
Why did that happen? Yeah.
So,
Again, one of those things. Maybe hey, we're going to the tournament. I'm not telling anybody my leg hurts.
Right.
I'm not, because I know that Dr. Frey. He's going to pull me out and he's going
Once
to
in
let
a
my
lifetime.
competition get in there.
Yeah.
I'm not telling him.
Not
There's-
taking that away from me.
I feel like it was a picture that circulated very frequently for a little while during, like, we go to our different conferences. Like, we're part of AOSSM. You go to like the annual meeting, the orthopedic sports medical meeting, and they would, every lecture, every time we were at a conference, you'd see like one or two, like the same picture coming up. And it was a picture of a guy who I guess, had a stress fracture, and he was a long jumper.
Yeah.
And as he's getting ready to take off, there's the picture of it, and like they snapped the picture, or whether it was videoed, and they could just pull that one frame where they snapped it at the perfect time. But it's like his thigh, his knee, his second knee, and then his ankle.
Yeah.
And you're like, it's like, oh man, and like that.
It's
that's
amazing what the body can get itself into. But yeah,
Absolutely.
yeah, I think so. That's my thought. Why did this happen?
Right.
Yeah.
Yeah.
No.
I thought the same thing too, because it didn't look like he came down. He was going up for a rebound, kind of landed slightly awkwardly, but not super hard, and you just see it goes.
Yeah.
and-
Hey, look, sprain an ankle, sprain a knee, but don't break your tibia. I mean, there's
Right.
something
Not
something
there.
wasn't
Yeah,
right. So
there's not there.
my prediction, my call is that there was a pre-existing
Yeah.
issue there.
Yeah.
And we don't know. We won't
And
know
I
what
think,
it is.
like you said, it doesn't like add up to where like he wasn't in a weird position. Like I think a couple years ago, Paul George had a very similar injury,
Right.
but he like ran into the back of the post, like
Yeah.
whatever it's called to hold it. He kind of ran into it, and that added some external force.
Yeah.
So there's nothing to this kid's. He just jumped up and came down, and then when he came down, his ankle went the other way.
Yeah.
Well, and that's one of the things that we're taught in training, right? So if you have a mechanism that doesn't seem to match the injury,
Right.
always think about why.
Right.
Is there a is there a pre-existing bone lesion? Was there a tumor there? Was there something going on that you need to kind of still work up? It's one thing to diagnose a tibia fracture and fix it, but then it's another to say, why did that happen? And do we need to look into this further? Is it they have a bone metabolic disorder or some weird thing? So
Well, I
there's
think
things-
that's something that, as athletic trainers too, and teaching younger student athletic trainers, you're always looking for the mechanical mechanism of injury there,
Right.
and you have to take a step back. And you're thinking mechanically, you also have to think medically sometimes as well too. And I think that learning how to think that way is really. It's we get it. An ACL is going to tear here because of torsion. This. Well, we'll put it there. And all that exercise physiology, human physiology, that that some people may have struggled with. There's the strong basis of that to cause things like that to happen.
Right.
So it's
There's so much video out there. It is actually helpful now at times, because I'd say like 80% of the injuries that we see, they're like, want to see the video?
same
And
thing.
it's
Yeah.
helpful
Yeah.
to see.
All
You're
the
like,
time.
okay.
It is
Everything
actually
is
pretty
recorded.
helpful.
Yeah,
It's like one of my favorite things when an athlete comes to me, guy got hurt, and he's like, "Yeah, I saw the video." I was like, "Wait, what video?"
Yeah.
Let's share, let's
Yeah.
see it, and let's
Huddle, right?
Yeah,
Huddle.
huddle,
Yeah.
all those different things. It makes it life a lot easier. It's just you can see what happened, or
Yeah.
they describe it one way, but it actually happens a different way,
Yep.
and then it makes a lot more sense why you're seeing what you're seeing.
Yeah, agreed.
So I think we kind of wrapped up those big injuries, and I think we can kind of push forward. And
So wait. So we
UConn-
think he's getting back and playing?
unfortunately, not with this one.
It's
That
a
poor
long
kid.
shot.
Very long
Sorry,
shot.
I didn't mean to
No,
cut
no,
you.
no, no, no. I was just gonna go ahead into like.
Well, you know what?
Okay.
One quick thing.
Yeah.
Transverse fracture. If you put a rod down the center of the bone,
Right.
walk right away, right?
Yeah, but you're
Nope.
not playing in it.
No, you're not playing. But
It
most
was
people would
open.
think, "Wow, that's crazy."
I know.
But you can walk right away.
But it has to be very flat. It has to be like you said, transverse, short,
straight
yeah,
fracture,
so it's
not
gliding.
angled or oblique. So the fracture pattern depends on how quickly, you can weight bear. It depends what we do. But yeah, pretty
Surprisingly
amazing.
so.
Yeah, I mean, I only put people in a bracer. I just put them in a soft dressing.
Yeah.
If you have a
So do you
transverse
think in
fracture.
this kid now? This is really a question for the trauma guy. I'm not holding you to this one. But do you think in this scenario, basketball player, are you riding him? Are you putting a rod through his knee?
Yes.
Or are you putting a plate on there?
I'm
and then taking it out later?
I'm
or
putting a
something?
rod through his knee.
Me
for,
too.
For a couple of reasons. One, a little bit safer for open fractures.
Yeah.
And you're not capturing all that potential contamination. That's even if you don't wash it out well.
Right.
God forbid there is an infection. It's a lot easier to take a rod out than have to remove a whole plate and
Right.
screw holes, and you leave a bunch of stress risers in the bone. So.
Yeah.
Yeah, and then suprapatellar, infrapatellar. There's a bunch
That's the
of-
next debate.
Yeah, but we don't have to get into it.
Sure.
That's upper level.
Upper level. Yeah. If only we had our trauma guy here.
Yeah,
Darn. But in regards to March Madness and the tournament starting, what do you guys think? Bold predictions, or who do you guys think is winning? And then secondary question is, what's our lowest seed is going to pull up an upset? Whether it be, you don't have to go exact team. I'm just talking numbers. 16 seed beating a first seed, and vice versa.
It's always
15
the
versus
first
2.
round. It's always-
Is that what
UConn's
it
going to
is?
win.
I think UConn's going to win. They're the best team in the nation right now. What they're saying is all the, Vegas is saying there's a 28% chance of them winning this year.
28?
28. But that picture everyone else involved as well, too. So that's a pretty staggering
Yeah,
statistic
that's a
right
big
I
number.
love upsets.
And they are.
Though.
I know.
I
They
love
are.
it. I love
Everybody
it.
likes a good
that's one of
underdog
the things great
Cinderella
about
story.
About the tournament. This is awesome. Like UConn
That's
is
what
going
makes
to
it
get knocked
great.
out right in the beginning.
They could lose the first night. I mean, very,
but they're
very
not
rare.
gonna.
Very rare.
They're not gonna.
Feeling good about your quasi alma mater?
Yeah.
Is that it?
I did my residency at UConn, and my wife was UConn grad, so that's easy for us.
They're a spectacular team that played in what I thought overall was a pretty good Big East, at least at the top, right? Between UConn, Marquette, and Creighton. 3 very, very good teams. I think a lot of people thought more than those 3 were going to get in.
I thought Seton Hall deserved to get in. I think
Yeah,
St. John's,
St. John's on the
yeah.
yeah, exactly. Maybe even Providence in the conversation. They dominated the Big East, and I agree. They're by far the favorite to win, but Purdue is really
I think
good.
that could be a final. That could be a good
Purdue.
final.
Right.
Yeah.
That could be a good
I
final.
was liking Purdue looking at everything
Yeah.
ahead of time. I was like, they got that. I forget his name. There's
The
big
big
guy.
Smith,
The big guy is just like he has like the most free throws
Turkish
in like
Hungary or
most free throws in college basketball the year by like 100. So like he just plays a much more physical game, and I think it could help.
I always get worried, and they're a good team overall. I always get a little bit nervous, especially like a big guy, right? Like, or if a team is able to get him into foul trouble, and sometimes you can, if you play your cards right, then a team like that might struggle. And yeah, I don't know.
Coach Steve.
Yeah.
Coach Steve.
There we go. But all right, then what about? I'm sorry, guys.
This started a fight in my clinic today because evidently everyone hates Purdue. They're like, "What have they ever done?"
Really?
I'm like, "No, you guys got to take
They were
it
really
easy."
good last year, too.
Yeah.
Well, until that first round game,
Right.
And
Well
that's
said,
where
well said.
Yeah.
That's
Wow.
when it comes up big, let's see what they can do. And I'm like, all right, we
What
got
kind
some
of
strong
training room are
opinions
you
there.
running over there? Yeah.
Very strong opinions.
Oh,
That much I
okay.
can say.
All
Very
right.
strong opinions.
The
We
good
got-
old training room debate.
that we got a lot of very smart, very in tune student athletes.
All right.
So that
Yeah.
makes for
I like
some
it.
raucous debate.
Yeah, good.
So
That's
It's
fantastic.
good stuff. It is. It is.
What about upsets?
I mean, the 16 seed being a number 1 seed only happened like one time ever, right? You know, it was a couple years ago when Virginia had lost to.
I do
Yeah,
remember
I
Virginia
remember
lost.
that.
Yeah,
That
that
was
was one of the
amazing.
upsets. It didn't happen again. I thought it happened.
Wasn't Purdue and FDU
I
last
think-
year?
I think
Was
that's
that
what it
one
was,
seed?
right.
That's
Yeah,
what.
Yeah, you're
that's
right. Sorry.
Shocking.
So
Right.
hopefully Purdue doesn't do that
Yeah.
again. They don't get a big upset.
I think Georgetown was the first 15 to lose to a 2, I think.
Wow. Good figure you know that.
Florida Gulf Coast, that was a tough one. I was at their game, and I felt like crying.
Yeah.
I saw some article today about the type of mascot and number 1 seeds and like biggest upsets, and the Houston is in trouble. That they're apparently they're the number 1 seed that could potentially lose, based off I forget who they're playing.
Longwood, right?
Yeah,
Is that
yeah,
Longwood?
Yeah. And that'd be pretty interesting to see. Just a smaller school just come out and beat Houston, who's been playing really well all
Yeah,
year.
yeah,
You know,
yeah.
another good team.
Houston's
Second
on a
year in
lot
a row,
of,
too.
on a lot of lists.
Yeah.
They were really good last year too, and so
Right.
it's like you only be at the top.
So
for
that's
so
your
long.
prediction? That's the big upset of the year?
Yeah.
All right.
I think
okay.
Houston's going to lose early.
Where are you
All right.
headed?
I like it. Oh God.
I know.
How about St. Peter's in Tennessee? What do you think about that? Why are you all looking at me that way?
I gotta be honest. It's a great way to.
Yeah.
I don't look for upsets. I look for wins.
Mm-hmm.
That's just me, though.
It's a win from the lower seed. That is what that is.
Yeah, but I
don't
mean,
know.
I think of it as I got to be honest. I think of it the other way. I think of it as the upper team giving something away.
Yeah.
So I don't.
That makes
even
sense.
though, Bucknell kind of, alma mater made it back in the day, made it in, had some big wins, and that was probably the opposite way to look at it. I tend to look at, a big team shouldn't give it away. They shouldn't. So that's just my.
And I think it happens
My
sometimes. Those bigger
thought
teams, they
process.
just play down to their competition level,
no
and they just kind of
question.
like, or
No question.
Or
That's
like
the
those-
classic locker room,
Yeah.
like speech.
yeah,
Don't take this team for
yeah,
granted. Right.
Because they're just as hungry as you are,
Classic.
and they're gonna
Yeah.
come out because you're the
or
big dog.
hungrier.
And they have
I
nothing
mean,
to lose.
Gonzaga
Right.
built their
That's
whole
it right
program
there.
on upsets, right?
Yeah.
Back in when did they start?
Year after
Like
year
people
after
didn't know
year.
who they were. They had a cool name.
Probably
but
like
nobody,
10, 15 years ago.
And-
then
and
all
they
of a sudden,
just all
they're
of a
not
sudden
a
were
mid-major
winning.
anymore.
No.
That's
Yeah.
legit.
They're relevant.
Yeah.
Creighton, same thing.
Yeah.
It's crazy. But
It's
that's
fun.
why it
It's-
makes it so much fun, though.
Yeah,
Yeah,
it
that-
is.
that's the beauty of
It
it,
is
right?
fun. This is the only part of basketball that I like. I got to be honest with you.
This is the only part.
Honestly, March Madness is awesome.
Craziness of March
Yeah,
Madness.
yeah.
It is fun.
It's
It's
a great
truly
sport
madness.
across the board. I can't believe it.
Yeah.
yeah. I don't know. I love it. It's one of the best times of year, right? Like
Yeah.
Agreed.
because one March Madness in and of itself is just a spectacular event, and then at the same time we're heading towards NBA playoffs. We're heading towards NHL playoffs. Baseball's just around the corner picking up. Like this is the opposite of the middle of July, right? The doldrums, the All-Star break.
NFL draft sneaking in soon,
right
too.
around the
Yeah,
corner. I love it. This is a
Thank
great,
God
great
the
time of
draft's
year.
coming.
Thank God.
Yeah.
That's exciting. Free agency started
That's
like a week
the
ago
exciting
for
part
NFL.
for you, the draft.
For me.
Not 6 other.
For me,
Not
on.
the active
NHL,
sports.
baseball,
No thanks.
Come
pro
on, man.
basketball.
MLS is up and running again. What the heck?
The Arena League's coming back.
It is.
That's what we've heard.
We'll see.
Yeah.
See what happens. So is the what is it? UFL?
USFL.
UFL, the XFL, and the USFL merged in UFL.
All
Yeah.
came together.
Should be interesting.
It will be. There's nothing wrong with year-round football,
No,
in my opinion.
No, nothing at all.
it gives everybody an extra chance, right?
They don't
You know?
have to watch those other sports.
Well, I will watch a bad football game.
I agree.
I will watch a
I
bad
100%
doesn't
agree
bad.
with that.
Yeah, I'm watching
Yeah.
Canadian League in the
Yeah.
middle of
Yes.
July. Am I really doing this? Yes,
Yeah.
I am.
Like 11 o'clock at night. There's
That's
nothing
it.
else on, but
and I have no idea what the
Just
rules are.
quenching
Like
that
you
thirst.
can't do that. Wait a minute.
Yeah.
Yeah, you can.
yeah, he just did that. He just kicked
Like,
the ball from there.
It's
What?
rugby.
How?
It's sort of like football.
Yeah.
Yeah.
Kinda, yeah.
I might even watch rugby
Wow.
instead.
Statements.
Well, I think we covered about everything tonight. So thank you both for coming out. It's been a
Thank
pleasure.
you.
It's been a good time.
Yeah.
Too long coming. I'm glad.
Yeah,
you're
Kevin,
I really
yeah,
had a great
it's-
time
this
tonight. Thanks
is-
for including me.
I'm yeah. It's been a pleasure
was a
working
good-
with you for these last 250 years. And, I hope we work another 250 years. You
I'm
let
not
me know
going
when you're
anywhere
ready to
if
go.
you're
Well,
not, man.
I'm not.
I'm not-
I hope not to go anywhere.
I'm not going
And that's the
anywhere.
epitome of a good AT and
Yeah.
physician relationship
Yeah,
right
that's
there,
good.
you know?
We
And
got
it's
a good
ironic.
thing.
Dr. Frey and I have an AT physician relationship, but it's completely different.
Totally
because
different
it's
one.
Totally
Yeah.
different
Is that
world
it?
over
Yeah.
here, you know what I mean? But it's still very important for our world, and I'm glad you both could come on and we actually
Yeah,
made it all
it's been
work.
great.
And like
Perfect.
we said, we've been trying to put these pieces together for a little bit. So
Yeah.
before we go ahead and close out our tab here, we just want to give a quick shout out to our sponsors, the Energy Lab, the region's premier sports performance center and destination located here in Pittman, New Jersey. Neck of the Woods Brewing Company, serving us up the coldest beer in Pittman, New Jersey. And lastly, Timber Rear Productions, helping us put this podcast together to you in video and audio format. So thank you, everybody. Have a safe one, and we'll be back soon.
May 18th, Sourfest.
Yes, May 18th, Sourfest for Neck of the Woods.
Sourfest.
Yeah.
Neck of the Woods
Right here,
Brewing
Neck of the
Company.
Woods, yeah.
And lastly,
Like the sounds of that, Doc.
oh, it's a
really
good
good,
one.
man.
This weekend on Saturday, March 23rd, come to Neck of the Woods from 12 to 4 p.m. to meet the hardworking people from the Veterans Multi-Service Center, the local one, and we're also in the middle of a
Clothing Drive.
clothing drive Operation Care Packages. You can bring donations here to Neck of the Woods Brewing Company.
Absolutely
All right.
awesome.
Very nice.
Have a good one, folks, and we'll see you next time.